Am I a candidate for upper and lower eyelid surgery? Am I a candidate for upper and lower eyelid surgery? I feel like I have to keep my eyebrows raised all day so I don't look miserable, and my eyes don't look ugly then. If I relax my face, my eyes droop down and look really ugly.
Thank you for your question. You submitted a single photo and you stated in your question you're asking, are you candidate for upper and lower eyelid surgery? And you mentioned that you raise your eyebrows to be able to show your eyes looking brighter. And so, based on this single photo, I can certainly give you some advice as to, or guidance as to how to think about cosmetic eyelid surgery and understand when it's right and if it's right for you. To give you a little bit about my background, I'm a board-certified cosmetic surgeon. I'm also a super specialist called an oculofacial plastic surgeon. This means that when I trained, I first trained in eye surgery, and then I did super specialty training in plastic and reconstructive surgery of the eyelids. This is considered in the world of plastic and cosmetic surgery a super specialization. So when general plastic surgeons or facial plastic surgeons have complications, patients will often seek out an oculoplastic surgeon, an oculofacial plastic surgeon, because of this unique area of training. I've been practicing for over 20 years in Manhattan and Long Island, so I can give you a sense of how I look at patients in determining whether or not they're a candidate for upper or lower eyelid surgery. So to begin with upper eyelid surgery, which I think is a little more straightforward based on your photo, you state that you raise your eyebrows to make your eyes look brighter. Now this is a very common maneuver, and a lot of times people do it so much that they actually develop very deep horizontal lines in their forehead. It's just to keep their eyebrows raised to show off their upper eyelid. Also, when the upper eyelids are heavy, very often people are misinterpreted as appearing tired. So for upper eyelids, that you might want to consider a cosmetic upper eyelid blepharoplasty. Now this is a procedure where skin is actually sculpted and removed, as well as, depending on the individual, muscle and fat in order to create a particular shape. And this determination is usually made first during consultation based on the doctor's knowledge and experience, and the patient and the doctor having a sense of the final desired outcome. And a lot of times during surgery we will see whether or not there's some fat and other soft tissue. This is a very artistic procedure, and the difference between good eyelid surgery and great eyelid surgery can be millimeters. And the difference between natural looking eyelid surgery versus obvious eyelid surgery can also be millimeters. So you can see why the obsessiveness and the specialization and artistry are such an important combination in making the right decisions during this surgery. For lower eyelids, we address lower eyelids for basically a common issue, which is puffy under eye bags. Now, from the photo you submitted, it doesn't appear that you have puffy under eye bags. So unless we were to do an examination where, at least with the photos, see a side view or profile view with the face relaxed or three-quarters view, I would probably suggest, based on the photo alone, is to not do anything about the lower eyelids and maybe just do something for the upper eyelids. Again, we can make recommendations based on photos, but with lower eyelids, the indications for surgery are puffy under eye bags, redundant or excess skin, which is actually uncommon, laxity or looseness of the lower eyelid tendons or support structure, and all of this has to be done in balance to create a very aesthetic result. So I think that at this point you should meet with qualified, experienced doctors who perform cosmetic eyelid surgery, and as per my bias, people who are specialists who really know this area, and I would even take that further, people who do a lot of cosmetic eyelid surgery. Even within a super specialty like oculoplastic surgeon, there are those who do more medical-based procedures, more outpatient versus more inpatient or hospital based. So it's important to get to know your doctor and learn about what they do and how much they do. And then, of course, look at before and afters to get a sense of results so you and the doctor can be on the same page. So I hope that was helpful. I wish you the best of luck, and thank you for your question.